My name is Claire Remmington. I'm a nurse specialist and I work with biofeedback, hypnosis, hypnobirthing, and I'm a licensed mental health counselor.
My name is Fred Remmington. I'm a psychiatrist licensed in New York State as a physician. I'm also a board certified psychiatrist by the American Board of Neurology and Psychiatry. We specialize in psychiatry and psychotherapy, which is essentially what I do. And we also specialize in the kinds of work that Claire does, which she can describe best.
We have a subspecialty of body, mind, and wellness, which we have set up as a center, and it's an adjunct to the psychiatric care that Dr. Remmington gives. And there are times when people don't need medication. They might need a headache program or a stress reduction program or help with fears and areas of their life that are just uncomfortable. And then I can counsel them with the help of biofeedback and self-hypnosis.
Well, my interest mainly is in providing a kind of a comfortable setting where patients can talk at length about the problems that bring them to see me. When I trained, there was much more emphasis on patients talking about their problems without worrying so much about the length of the time involved, the expense of the time involved, what medication to use, and things of that sort, which are really a big thing today. When I trained, there was much more emphasis on schools of psychiatrists, as Freudian, Jungian, and other such things, which were really not primary then, but they were sort of fading out as people got more interested in interpersonal problems between family issues, between social issues, and so forth. And time wasn't so much a rigid issue then. But as the medications came in, and that of course involved a lot of expense, things became tightened up to the point where you really had trouble allocating time for patients. Now it's gotten very much more strict to the point where in many cases people are limited in how much time they can see patients strictly on the cost involved. Now that's not to criticize the drugs, because the medications have been marvelous. The medications are some of the reasons why state hospitals are closing, why patients can now go home and stay with their families instead of being locked up for decades in hospitals. And they've been marvelous as far as they go. But all the problems people have are not resolved because of medications. A lot of them are interpersonal problems, social problems, problems from the past, and so forth, and they need to be talked out. And this is where we have a problem, because people can't afford the expense that's involved. So after this got developed beyond a certain point, I found I couldn't be comfortable doing this. So I made a personal sacrifice, and Claire and I talked about this at length. We decided we would simply set aside a certain amount of time for an intake for a patient, perhaps an hour, irrespective of the cost. And then we would see people for follow-ups, perhaps 30 minutes, irrespective of the cost, because we couldn't stand doing it in a way that wasn't satisfying to us and the patient, and we simply did that. And we took a decreased income because of that. We felt it was the right thing to do. And this worked out for us. And that's sort of the way we function. When people come in, we take a good history, and we take whatever time is necessary, and then we determine from that the medications that are necessary, and we try and determine the time for the follow-ups. The follow-ups are less than the original visits, but they're what we feel the patient needs, and that's the way we've gone on this. Now that fits in very well with the kind of work that Claire has talked about too, because you can't do that quickly. It takes a certain amount of time.
Right.
And that's sort of where we are now. Mm-hmm. The insurance companies have done a wonderful thing too, because they've made Medicaid, Medicare, and so forth. They've made care available to a lot of people that couldn't otherwise have it. But it also has its limitations, and we see this in society, where there's a lot of struggle now to figure out what kind of insurance we need, how it would go, how long it would go, who would do it, and so forth and so on. So we're in the midst of this too.
We notice that in recent years, medicine, with all of its miraculous techniques, very, very good medications, very, very good, excellent treatments, has become increasingly impersonal. So that often when you go into a medical establishment, there's a very sterile atmosphere. Many times you have to present your license for ID. You may be not considered a person, you're considered a diagnosis. And the medical establishment focuses on that particular part of your body that is in trouble. And they do not address the whole person. And so we decided to set up our practice in such a way that it would be comfortable for people to come, comfortable for them to relax, to sit, to talk. They often talk with each other. And it's an intentionally relaxed practice in order to address the person as a body, a mind, a spirit, a history, and a present problem, so that we can look towards the future and set goals that are going to reestablish a more beneficial lifestyle. Okay, hypnobirthing actually started in the mid-50s. There was an English doctor by the name of Grantley Dick Reed, and he discovered, through observing a very simple lady with a leaking roof and a blanket over her, that she didn't need any pain medication. This was when doctors were making home visits, and he walked in, he said, "Can I give you any pain medication?" And she said, "Do I need pain medication?" And he said, "Well, not necessarily." And he sat down, and she had a baby easily and calmly with no discomfort at all. So he ended up writing a book, Childbirth Without Fear. This was in the 50s. Then came Marie Mongan, who is an educator and a hypnotherapist in New England, and she took her work from the basic work that Grantley Dick Reed did, and she expanded it, and she set up a program to prepare not only a woman but a couple, whether it's a husband or a partner or a family member. Two people with 5 2-hour classes can learn how to prepare themselves for an easy, comfortable, relatively painless birth. And this is not separate from conventional medicine. This is in collaboration with conventional medicine. So the couple is taught how to present themselves to the hospital and how to work with them, so that if anything goes wrong during the birthing process, the staff can step right in. But they're both communicating back and forth all the time. And the couple learn how to set up this bubble of energy around them, and the husband or the partner learns how to keep the mother in a deep state of hypnosis by using anchors. An anchor would be a kinesthetic pressure, or a stroking of the arm, or a verbal affirmation. And it's very supportive, it's very gentle, and the staff knows this, and they tend to stay away. The room is quiet, there's quiet music playing, and if at any time she needs to walk, she can walk. If at any time she needs to go into the jacuzzi, she can go into the jacuzzi. And if any time they notice that there's anything that's untoward that's going on with the mother and or the baby, they discuss it with the partner, and all three of them can decide what it is that they need to do medically. And there was a study done in Canada where they found that the hypnobirthing mothers had their babies within 4 to 7 hours. an average first birth takes between 18 and 19 hours. So this is a very effective method for making a birth a wonderful family event. So it's not just the birth of a baby, it's the birth of a family.